Ben and Jen, both parties agree on no more mandatory overtime. What the hospital and the nurses union have yet to agree on is pay and health insurance benefits. They met again on Monday to discuss, but still no contract has been signed. And as nurses get ready to strike, the union president says this is all about the community.
Our impact on this community is just that important. And we are, such a rural area, and we do have limited services.
Andrea Riley is a nurse at Windham Hospital and represents nearly 100 other nurses there in local union 5041. It's the closest hospital for many in eastern Connecticut. Nearly all the blue-scrubbed frontline workers will redirect their steps to the streets Thursday as they strike for 2 days over pay and benefits.
We've asked them over and over, let's look at the numbers, let's look how far off we are, and we always got resistance.
The union wants wages to increase to match the cost of living after no increases for the past 2 years. They also want better health insurance with lower costs. The hospital in the Hartford healthcare system has an offer on the table to address all of this, but Riley says it's not enough. The offer includes pay adjustments and wage increases, as well as insurance premium contribution relief. In a statement, a spokesperson for Windham Hospital said they are disappointed an agreement has not been met. Quote, "The hospital has made it clear that it is willing to consider options within the economics of a proposal we have been discussing since the end of June." Riley says their economics are not what's best for the nurses.
Looking at the economics, you can't offer decreases with insurance and premiums for nurses that are not in that band.
Riley says the insurance relief only benefits about 40% of the union nurses. She says the difference between what both parties want is not big. The president wants a hospital that can recruit and retain nurses to serve Connecticut and argues that's what they've been pitching to hospital leadership.
It's not about the nurse, it's really about the patient. Our nurses want to stay here.
The hospital says there may be surgeries and procedures rescheduled to ensure safe patient care as the nurses go on strike. Other nurses from the Hartford healthcare system will be filling in to provide care during this 2-day strike. It's scheduled to start tomorrow morning at 7 o'clock outside the Willimantic Hospital. Riley hopes it only lasts for those 2 days and hopes that they can agree on a new contract next week. In the newsroom, Tony Black, Fox 61 News.